Joining us now is Dr. Anthony Fauci, the chief medical advisor for President Biden and director of the National Institute of Allergy and Infectious Diseases. Dr. Fauci, good to see you as always.
Good to be with you.
Let's start with some good news for a change. The 7-day average shows a drop in cases in this country of about 30%. Hospitalizations are down as well. How real is this drop off? Is it possible with the vaccines that we are starting to see the beginning of the end, or at least the worst behind us?
Well, you know what I think this really is just the natural peaking and then plateauing and coming down. The number of vaccines that we've gotten into the arms of people, good start. We want to keep going, get a lot of people vaccinated. But I don't think the dynamics of what we're seeing now with the plateauing is significantly influenced yet. It will be soon, but yet by the vaccine. I just think it's the natural course of plateauing. We see when you get off a holiday season, we were expecting that there may have been even more. Apparently not. We're going to come down and stay there. The one thing we have to keep our eye on, we don't want to get complacent and think, oh, things are going in the right direction. We could pull back a bit. Because, we do have circulating now in this country a variant from the UK that's in over 20 states right now. That is a variant that has a better capability of being transmitted more efficiently from person to person. So it's one of those things, there's good news, but there's also sobering news. The good news is what you just said, that we seem to be plateauing. The sobering news is that we cannot bring our guard up and lose the intensity of being able to use the public health measures to prevent the further spread.
Well, the bad
because if in fact the variant becomes dominant, if the variant that has greater degree of transmissibility becomes dominant, we're going to be faced with another challenge of a virus that has a more efficient capability of spreading.
And that leads me to the next question, because this variant from the UK, which the CDC has said will likely become dominant, the UK just announced that it's not only more contagious, it's more deadly. How concerning is that?
Right. Well, obviously, that's always concerning when you see that. The data has not come out officially, but taking a look at the preliminary data that the UK scientists have analyzed, I'm pretty convinced that there is a degree of increase in seriousness of the actual infection, which we really have to keep an eye on.
Let's talk about South Africa. It has its own strain, actually, I believe a couple of strains, but one of them has been shown to perhaps reduce the effectiveness of the vaccine or antibody protection, which is, of course, very disturbing. The Biden administration just announced a travel ban to go in effect on South Africa. Is it fast enough? How worried are you that South African strain is coming or may already be here?
Well, let's unpack that a bit. First of all, yes, we are more concerned about the South African strain right now, because when you do studies in the test tube, in vitro studies, it shows that the ability of monoclonal antibodies that have been used for therapy, that is really impaired in the presence of these particular variants. In other words, these monoclonal antibodies don't nearly work as well as treatment. There is a very slight, modest diminution in the efficacy of a vaccine against it, but there's enough cushion with the vaccines that we have that we still consider them to be effective against both the UK strain and the South African strain. But we don't want to take that lightly, because these things continue to evolve. But I don't want people to think at this point that the vaccines are not effective against them. They are. However, we really need to make sure that we begin, and we already have, to prepare, if it's necessary, to upgrade the vaccines. We're already taking steps in that direction, despite the fact that the vaccines that we have now do work. Your question about what we want to do with travel from South Africa, I believe it's very prudent that the president made the decision to essentially block travel from South Africa from people who are non-U.S. citizens. And there's also going to be an additional situation where anybody coming into the country is going to have a negative COVID test before they get on the plane. And when they get here, they're going to have a period of quarantine together with a second test. So we're really taking very seriously the potential for the influx of these types of mutants into the country.
A lot of folks are hearing now about double masking, wearing 2 masks or trying to get one of those N95 medical grade masks. Do you believe that that's
You know, it likely does, because, I mean, this is a physical covering to prevent droplets and virus to get in. So if you have a physical covering with one layer, you put another layer on, it just makes common sense that it likely would be more effective. And that's the reason why you see people either double masking or doing a version of an N95.
As we await this vaccine rollout to really get going, this new CDC director said the government has no idea how much vaccine they have, so states and localities can't even really plan and make those appointments. Ron Klain, the White House chief of staff, told Meet the Press that there was no process for distributing the vaccines beyond nursing homes and hospitals. I mean, you have a unique insight because you've actually been there the whole time. How did this happen, and how quickly can this be fixed?
Yeah, I think we're going to get our arms around that pretty quickly. I think I imagine that the comment of the CDC director, Dr. Walensky, was taken a little bit out of context. What she was trying to say is that there are multiple steps: producing the vaccine, getting it into the vials, getting it shipped, getting it distributed, and getting it into people's arms. And there are, there's vaccine at each one of those steps. And there is confusion when you ask a given individual, well, how many are at this stage and how many are at that stage? What I had done in the past is call up the person who was responsible for that type of a distribution to the local places where they should be. And that's the person involved in Operation Warp Speed, General Gustav Perna, and that he could tell you exactly how many will ultimately be shipped. So we're going to get that number. But Dr. Walensky was right. There is a bit of confusion when you ask at any given stage, but we can get our arms around that and get that information pretty quickly.
All right, Dr. Fauci, as always, it's good to have your perspective and your time this morning. Thank you so much.
Good to be with you. Thanks for having me.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.